I'm Daisy Antique. I'm one of the hospitalists. I've been in this facility for over 15 years. And I'm very proud to be part of this endeavor to try to get a hospice unit or hospice house going.
It's difficult to lose a loved one. There's no how-to books, there's nothing like that. It's difficult and it's hard to go through. But it's difficult to sometimes go to the home facility or stay in a hospital setting. In the hospital, you have to worry about visiting hours, you have to worry about just other restrictions and things of that nature.
Transitioning to a level of care where you're not concentrating on trying to cure an individual or cure disease, but to provide them the maximum quality for whatever quantity remains is very, very important. And I'm a strong, strong advocate of that.
Becoming involved with hospice was one of the best things that happened to me in regard to the armamentarium, or what I had to help patients and families. Jackson is the only healthcare system in West Tennessee. It provides health care for 500,000+ people in 13 counties.
People would go to a hospice home if we can't keep their symptoms managed at home as well as we'd like to. The family may need a rest, and they can go for respite just to give the family a break and that person that's sick a break. But hospice is something that people are going to need more and more toward the end of their life. And we need that facility here in Jackson, Tennessee.
A hospice house for West Tennessee healthcare would be one of the most phenomenal things that we have probably done in the past 5 or 6 years. It would add to our mission of being a facility that would add compassion and bring the excellence that we want to provide to the communities that we serve.
You never know when a chronic disease, whether it be cancer or other life-limiting diseases, can hit you or hit someone in your family that you care about. And it's just very difficult during those times, all the decisions that have to be made. And it's not always the best thing to do to keep them in a hospital.
So a hospice home is very different from the hospital and a patient's home setting. So in the hospice home, it's going to be 24-hour staff, certified staff taking care of these patients during end of life or for symptom management, or if a family can't take care of them in their home setting for some reason or another. Sometimes families aren't able to care for them. You might have an elderly person taking care of their loved one, and there's no other family to help. And so during this in the hospice home, we have staff that can be with them 24/7, manage their symptoms.
Having a hospice house in Jackson means compassionate care close to home. It means a peaceful place to be with friends and family, to celebrate a life well lived.
A hospice home here in Jackson, Tennessee would mean a world to not only myself, but to my family, my extended family, and to those in our community. Being able to have a hospice home here in Jackson, it will serve not only our residents, but the residents of West Tennessee who need a place to go to in those critical final moments where you want to be surrounded by loved ones and those who care about you the most.
Hospice is near to my heart because it's important. It's important that we take care of one another, and it's definitely needed in our community.
What we want to do is be able to be a part of this program. We want to provide a donation and want to encourage other people to provide a donation to help get this type of facility to be used here in Jackson. We feel it's a worthwhile cause. It's something that is definitely needed. And end of life is a time where you want to be able to have a great impact on those who you are leaving behind and are leaving a legacy for.